Hi everyone, I'm Dr. Berzin. I'm the founder and CEO of Parsley Health, and I'm so excited to answer your questions in this Ask Me Anything for the Little Spoon community. So stoked! Should my husband and I stop trying to conceive during COVID-19? The answer is no. There's no evidence right now that there's any risk of trying to conceive, getting pregnant, or even being pregnant, either risk to yourself or risk to baby from the data we have so far. So if you are trying to make a COVID baby, as of what we know right now, I say go ahead and go for it. What's the deal? Someone asks about walking around or getting up and moving if you do have COVID-19. So if you do have it, and you know you do, or if you suspect you do, and you aren't so sick that you need to go to the hospital, and please, if you're not sure, check with your doctor or contact someone immediately. But if you are recovering from it or battling it at home and it's safe to do so, we are recommending that you get up and do not just jump on the treadmill, but do walk, stretch, breathe. Now is the time to put your hands on your rib cage and go, really fill those lungs as much as you can with oxygen. That might bring on a bout of coughing, but it's really important to oxygenate your tissues as best you can, and being stagnant and sitting and lying down for too long, the pressure of that, the weight of that on the lungs actually can reduce the lungs capacity further. So you want to increase your lung capacity. Deep breathing, don't hyperventilate, but deeper breathing, stretching and moving. Why do kids not seem to be affected by COVID-19 so much? So, well, there's two theories on that. One, that a lot of the symptoms that you get from the virus itself is actually your immune system responding to the virus. It's the immune response attacking the virus, trying to get rid of it. And so the two theories are that one, kids' immune systems are not as developed, and so therefore that attack is not as strong, and so they're asymptomatic, but they can be carriers. Another theory is that the virus itself has a harder time binding onto kids' cells for some reason. And so the real answer is we don't fully understand why yet, but by and large, from what we're seeing, kids do not seem to be getting sick from this virus, although they may be carriers of it, they may be transmitting it, even though they're not having symptoms themselves. Foods to help your immune system. So remember, food, nature's original supplement, people. So all of those phytonutrients in plants, leafy greens, eat the rainbow. So peppers and greens and all of the vegetables that you can find, basically those are your best supplements. They're going to keep blood sugar low through high fiber, through water, through all of the phytonutrients in those plants. So eat the rainbow, as I like to say, and then avoiding sugar and refined carbohydrates, or white sugar, white flour, even if it's coming in a gluten-free, paleo, blah, blah, blah. If you're baking a lot of baked goods, sugar and refined flours are inflammatory to your body. So I know it's tough with kids, but making them super healthy smoothies that don't include a ton of sugar other than some good like fruits, like berries, maybe half a banana, making sure that you're not having just plain fruit with a meal, but making sure that you're having. So a little bit about the antibody test. So the antibody test is not looking for the presence of the actual virus in your blood. It's looking for your immune system's response to that virus. And so the antibody test looks at a couple of different proteins in the blood that your immune system would have made if you had seen the virus, at least if you'd been exposed for at least a couple days. So if you got the test too early, it might not show anything. If you got the test in the first couple weeks, it would show certain proteins that tell us you're really early in exposure. And if you got it later in exposure, after about a week to 2 weeks, we would see that you had cleared the virus and that your body had made an immune response to it. Now, does this mean that you are clear, that you're good to go, that you can run out into the world? So no, not yet. We don't know yet to what degree having an immune response to the virus and having made antibodies will confer immunity in the future. That's something that we need to figure out as a population, as a globe. We are hopeful that having antibodies. So someone asked about anxiety, and yes, everyone is experiencing personal anxieties, collective anxieties. We're all kind of tapping into this collective energy and feeling it. And how do I deal with that when I'm home? So first of all, you got to move. Moving your body is the way that you discharge emotions. You move the energy through your body. So whether it's yoga or going for a long walk or jumping around and dancing in your room for 20 minutes, That's where I'd start, and then developing a breathing practice. Inhaling for 4, exhaling for 6, inhaling for 4, a count of 4, exhaling for 6, and set a timer for 2 minutes and do that a couple times a day. That will stimulate the vagus nerve and that will relax your nervous system. Those are 2 of my favorites: moving, meditation, and then my third M, magnesium glycinate. I take 200 to 400 milligrams at bedtime for a deeper sleep and overall calm. It's non-addictive, and it's kind of like nature's Xanax. So what do you do if your favorite supplements or the supplements that you're looking for to protect yourself are out of stock, like vitamin D, zinc, etc.? So the supplements that we're recommending, things like our Bodyguard supplement for prevention at Parsley Health, vitamin D3K2, and zinc. The good news is you can get a lot of these things still. And if you can't find, say, zinc, for instance, by itself, the happy news is that there's often zinc in a lot of other supplements. So for instance, Parsley Health's One and Done multivitamin or our Rebuild protein shakes actually have zinc in them. So look at the labels, read the labels. It's so important to read supplement labels so you're not doubling up on supplements and having really high quantities of things because you're taking lots of different supplements. It's also a good time to look for the key ingredients that we're recommending in other supplements. So recommending 10 to 20 milligrams of zinc a day, at least 2,000 international units of vitamin D3K2. Okay, rapid fire questions. Number 1, first, non-social distancing activity. Oh my gosh, so many. 1, going to my local coffee shop and getting a coffee. 2, having friends over for dinner. And 3, probably getting on a plane somewhere, I hope. Second one, what's the most underrated ingredient in your pantry? Mayonnaise. I really like mayo and homemaking it from eggs. It's actually dairy-free, which a lot of people forget. And if you get the healthy kind of mayo, it's a high-fat sauce that's delicious on vegetables, on French fries, and I don't know, I kind of forgot about mayo, but I actually think in small quantities it's great. My quarantine habit is probably listening to music in bed in the morning while I feed my baby and kind of relishing for a few minutes not having the commute while before the rest of the day just gets crazy. Current binge show, definitely Schitt's Creek, hilarious. Go-to activity to unwind is online yoga, doing the class with TT, just getting moving in my bedroom. Best lesson from my kids through this. Best lesson from my kids is don't worry, be happy. My kids aren't worried about what's happening tomorrow or a month from now, and me worrying about it isn't changing it. So being present, just being here with everything that's happening is the lesson.